Welcome, Professor Catterson from Australia, and I hope you have enjoyed your stay. And it's my honor to give this talk in front of our prestigious professors in endocrinology, Professor Karen Lam, Professor Yang, and also Professor Catterson. So without any delay, let me start my talk. I have no disclosure. So this is the outline of today's talk. I'm going to talk about the diabetes and cardiovascular diseases. We are going to discuss whether treatment of diabetes will improve cardiovascular outcomes. I will discuss about the results of the DECLARE-TIMI 50X study and also provide some insights. So diabesity, this was a very new words to me when I joined the Hong Kong Obesity Society. But in fact, it was first quoted in 1973 by Professor Ethan Allen Sims to describe the close relationship between type 2 diabetes and obesity. And in fact, 80% of the patients with type 2 diabetes are also overweight or obese, and 20% of the patients with obesity has undiagnosed diabetes. Therefore, it's prudent for us to screen diabetes in patients who are obese and as well as screen obesity in patients who have type 2 DM. So this is a summary of how weight impacts type 2 diabetes. So increased weight actually can increase insulin resistance even without damage to the islet cells, and it can result in hyperglycemia. In fact, increasing weight also can lead to dyslipidemia as well as hypertension. And these are all known to be very important cardiovascular risk factors and can result in microvascular dysfunction and also macrovascular macrovascular events. So this is a summary of the overall cardiovascular disease in patients with type 2 diabetes. As you can see, about 1/3 of the patients with type 2 diabetes also have cardiovascular diseases, including heart failure, coronary artery disease, as well as stroke. So you may think that with the advancements of medical care for both diabetes and cardiovascular diseases, we would expect an improvement in outcomes of these conditions. And nevertheless, you can see this is an analysis of a survey data over 3 decades. You can see that yes, to some extent, there was a drop in the mortality associated with major cardiovascular disease, ischemic heart disease, and stroke. Nevertheless, we do not observe any reduction in heart failure related death as well as arrhythmia related death in patients with type 2 diabetes. So it appears that heart failure is an important cause of death in patients with diabetes that cannot be managed by current medications. So what is the magnitude of problem of diabetes and heart failure in Hong Kong? So this is a recent studies performed in our hospital, and we found that in patients who have new onset heart failure hospitalization, 40% of them has reduced ejection fraction, and 60% have heart failure even though they have preserved ejection fraction. And diabetes is a cardiovascular risk factors of heart failure in 1/3 of patients with both patients with heart failure with reduced ejection fraction as well as heart failure with preserved ejection fraction. As you can see on the right side of this diagram, you can see that the mortality is actually pretty high. And in about 5 years' time, half of these patients with new onset heart failure died. So the mortality remains to be very high even in the era of like anti-heart failure drugs like ACE, ARB, and widespread use of beta blocker. So I can say that diabetes and heart failure are both very important conditions in our locality as well as worldwide. And it is prudent for us to manage both conditions.